To present the first case, I invite Dr. Constance Ching. She provides technical support in advocacy, implementation, and research in relation to the International Code of Marketing of Breast Milk Substitutes and infant and young child feeding protection across regions for Alive and Thrive. And she also provides technical experience in scaling and adapting the code monitoring digital platform in various countries employing innovative digital technologies to monitor code violations. Please, Constance.
Yeah, thank you. Okay, so thanks to the organizers for having Alive and Thrive here to present on our latest projects. So I'm going to dive right in. We first used AI technology to monitor violations of code law back in 2022, and the prototype or the pilot project was started in Vietnam. We published a paper it's shown in here in Maternal and Child Nutrition of the experience and the findings of the we call it the Virtual Violations Detector, the AI detector, and we call it VIVID in short. So I'm not going to go into the details of this project because we have more to come, but please feel free to go to the paper to look at the documented process of developing and implementing the tool, working closely with government agencies, and also the findings, as well as the recommendations, have been submitted to the government of Vietnam because they are currently reviewing their code law at the moment. So after developing VIVID, the AI auto detector, we realized that the AI detector is only limited to scanning digital platforms. And we're missing out other parts where violations happen. So in consultation with partners and countries, we developed, we expanded the VIVID tool into the code monitoring digital platform by adding 2 additional features. In addition to the AI feature, which only scans the digital platforms, we added a crowdsourced online reporting form primarily for non-digital settings, and also to encourage public participation in monitoring, and also an e-hub to host code-related references and materials for advocacy and also for learning and educational purpose. So since the pilot in 2022 back in Vietnam, with the support of UNICEF country offices, starting in 2024, and also I need to mention WHO for organizing the 2023 Code Congress that gave us also the opportunity to present on our prototype. In 2022, we started adapting this platform in 4 countries. It started with Mexico, and we progressed to work on projects in Argentina, Laos, and Mongolia. And out of these 4 projects, Argentina has already launched their platform in March. And these 4 platforms are supported and working in collaboration with UNICEF country offices and also with UNICEF country offices as the focal points in the country. These are how the platforms look like, their homepage, and only Argentina has been launched to the public. And we'll announce when the other platforms are launching in the other countries. So just wanted to touch base on the process of implementation with these platforms. So the process is a country-driven implementation process divided up into 5 phases. identifying national context and needs, and then we built the tool, the platform, working with the country, and then we actually go into the country to do a testing workshop, and that's a really, really important step, which I will talk more about later. And then review the feedback given during these testing workshops to refine and revise these platforms. After that, the platform will be launched, and then after the platform has been launched, we will then provide the support, if requested by the country, to analyze the findings and also to help manage and disseminate the evidence and the knowledge. And again, those two steps, we will only be involved if we're requested to support the country. And throughout the entire process, our role is technical support. We consult and coordinate with the country expert group. So each country out of these 4 countries has an expert group that oversees and also works with us very closely on developing these platforms. And they're made up of national civil society organizations that are relevant to the work, and also the relevant government agencies. And throughout the process, we work with UNICEF as the focal point in the country. These are the pictures from the 4 testing workshops. In the past 6 months, we visited these 4 countries to basically conduct testing workshops. And of course, during the testing workshops, the working group test the platform and the tools, and also provide feedback so that we can revise the platforms. But other than that, we also work with the country group to analyze the marketing and legal and enforcement landscape of the country. We also work to support to sensitize government officials on the code, the history and the spirit of the code, because a lot of times enforcement agencies in country may not have a public health or breastfeeding background. So, for example, in Mongolia, the anti-monopoly agency is tasked with enforcement, and they don't have a health background. So we sensitize them, help to sensitize these government officials on the code. We also, the workshop also provides a platform for these different actors to come together to communicate and to coordinate on their action. A lot of times, these different agencies or organizations, they don't really physically get together to talk with each other. So these workshops become a really good platform. And also, we provide the support to help map out their actions, meaning not only which entity is responsible for the violations, but which entity is responsible for taking action, enforcement action. They need to kind of talk amongst themselves, which ministry is responsible for what, and also how do they use the tool, how do they utilize the findings, who will be utilizing the tools. All these things need to be worked out, and this is a really good opportunity to talk about all these things. So I want to highlight the platform that has been launched from Argentina. It's called Observamas, which is short for Observatorio del Marketing de Sucedáneos. I hope it's okay. My Spanish, they've trained me a little bit through working on this. There's also the QR code to go straight to the website, as well as the website URL here. This is how the website looks like. And these are the people behind the scene on the ground, working to manage the website and also to process all of the violations. So they really, really deserve the spotlight. And they're from Sarnar Foundation. So they're actually a very prominent NGO in Argentina, in the forefront advocating for public health issues, especially relating to harmful marketing on health. Here they are. So this is the page of the AI detector. So we have identified pages and links that we want to crawl, including Facebook, Instagram, pages and also company websites. And you can see that the violations that are scanned or crawled are actually benchmarked against the international code and relevant WHA resolutions. You can even see that we've trained the AI tool to identify which articles of the code or WHA resolution. It's all in Spanish as well. So we built the platforms in the national language, all of them. And also we've taught the AI tool to identify what type of violations. So it can actually identify what types of violations that these entries violated. And it's also benchmarked against the international code as well as the national regulations so that we can, first of all, help to generate actions on the ground, enforcement actions, as well as to see the gaps between the national measures as well as the code and resolutions. There is an internal verification process where the monitor can log in to verify, to tell the tool and whether they've done it correctly and to correct if necessary. And this is to ensure accuracy of the AI tool, because the more the human logs in to teach the AI tool, the more accurate it becomes. And also we want to make sure that there's actually real interaction between the human and the data. And, people are not being complacent that, the AI is going to do everything. We don't need to look at it. Also to ensure liability issues. So this depends on the country. The country decides that they only want to publicize entries that have been vetted by the monitor to ensure that they're addressing the liability issues. And this is, again, a country preference. So just to show very quickly, this is an online form that the public or anybody can report other types of violations, such as things that are found in healthcare facilities or things that are found in a shop. They can send in the pictures, so it's pretty self-explanatory. It's an online reporting form. It also populates into a table where once the entries have been confirmed, they will be shown to the public. And this form, I have to also mention that this form is adapted from the IPFAN Quick and Easy form, as well as the Netcode Universal Ongoing Monitoring form. So this is also on the website as well. And also this beautiful code resource hub that they've worked very hard on that contains both national code-related materials as well as international code-related materials. You can find all these on the Observamas website. Okay, findings. They've worked very hard to analyze or to extract the findings from July last year to January this year. And a report with 231 verified violations. It doesn't mean that the AI tool has only scanned 231. It means that these violations that are submitted to the government agency tasked with enforcement, NMAT, National Administration of Drugs, Food and Medical Technology, Sanar Foundation has done the work to vet and verify these violations. So as you can see, 231 verified violations have been reported to ANMAT. The top two are the usual suspects. Danone and Nestle rank the top two. And then Romer's, the third, and also Philips Advent, Chico, and Nuke. The tool can also identify types of violations. So out of these 231 verified entries captured by the AI, we've also submitted the numbers of the types of violations. So each entry can contain multiple types of violations. Hence, we have 544 as the total number. At the bottom. But as you can see, the top three categories are promotion to general public. Of course, they are from the social media or from the digital platform, so they're all promotion to general public. Nutrition and health claims, second. And third, labeling with idealizing text and images. Enforcement action following the report of these entries to ANMAT. So ANMAT actually requested Nestle, Danone, and Romer's to remove the reported links from their social media accounts. NMOT also issued warning notices to these three companies to stop them from further disseminating promotional content on social media. And they've also initiated 3 health summary proceedings against Nestle. So what's a health summary proceeding? It's an NMOT administrative procedure to investigate and sanction health regulation violations. SANAR will be releasing a report of this officially. Currently, it's still in draft, and I've extracted the numbers from SANA, so thank you, SANA, for allowing me to do that. But they will be publishing the report when they have completed, have a final version. So, but really, congratulations, Argentina, for having some enforcement actions. And that's really the goal of us helping to develop these platforms, is that we want to generate some kind of action on the ground. It ranges from a warning to telling the company to take down the pages, all the way to penalty and sanctions, whatever is doable and possible within the country. How am I doing on time? Okay, all right. So I don't want to be a spoiler because Mexico will be releasing their platform very soon, but Mexico has named their platform Código Lactancia, and all these are named by the country expert group, to have the ownership over the platform. And I just wanted to highlight that without spoiling their launch, that this is the online reporting form, but what they're doing is, and this idea actually came from UNICEF Mexico, that any confirmed violation reported through the online reporting form, once it's been confirmed as a violation, the entry will go to the public page. Not only that, an automatic email with all the information provided will be automatically sent to government agencies tasked with enforcement, including the National Institute of Public Health, INSP, the National Center for Gender Equity and Reproductive Health. This agency actually provides the support to process the entries, and also COFEPRIS, which is one of the very key enforcement agency, which is the Federal Commission for the Protection Against Sanitary Risk. And this email system has already been set up, and we've tested and used it already. And also, pins on the Mexico map will show up where the violations are found to put pressure on the government to take some action. Whether it's going to the facility to tell them, hey, stop this, we don't like this, just take it off, or some kind of sanction or penalty. But the pin will stay up until we hear back from the government agencies that some action has been taken on this violation. So this is how Mexico has designed this monitoring form. They will be launching the entire platform, so I don't want to spoil, but let's hear from Mexico, UNICEF Mexico, what they want to say on this.
Hola, ¿cómo están? Saludos desde UNICEF México. My name is Matías Saxe. I'm the nutrition officer, and I'm very excited to share one of the steps we're taking to protect and support breastfeeding in Mexico. It is called Código Lactancia, which is a digital AI-powered platform to monitor violation of the international code to regulate the traditional and digital marketing of breast milk substitutes. Thanks to our strong collaboration with the government, especially with the Ministry of Health and the Mexican Institute of Social Security, as well as with academia and civil society, we're about to launch this much-needed tool during the next World Breastfeeding Week. Código Lactancia empowers citizens and health professionals to report violations while providing government with evidence-based tools for enforcement. My favorite feature is definitely the AI-powered detection of digital ads, but I also like a lot interactive map, which probably Constance will show you to you, which shows real-time violations to guide targeted action.
Thank you. The map was his idea, but so we look forward to the World Breastfeeding Week in August for the launch of Código Lactancia, and thank you very much for giving me this time to present this.